Today, we're breaking down topical antimicrobials, what they do, when they help, and the signs they're actually holding healing back. By the end of this video, you'll know how to look at a wound and say, okay, this is working, or no, it's time to switch it up. Here's the truth. Sometimes the wound isn't the problem. Sometimes it's what we're putting on it. That antimicrobial you've been faithfully applying every day, it might be doing more harm than good. Let's talk about how to tell the difference, because this is one of the biggest turning points in wound care. For those who don't know me, my name is Dr. Theyre. I've treated hundreds of wounds, some slow, some scary, and what I've learned is this: you don't always need to go stronger, you need to go smarter. And once you understand how these topicals actually work, you'll stop guessing and start leading the plan with confidence. If you're a nurse, provider, caregiver, or even a patient wondering why your wound is stuck, this is for you. You don't need a lab test to figure this out. You just need a trained eye and a little curiosity. Here's what we'll unpack together: when to start or stop using topical antimicrobials, why using them just in case can actually delay healing, what warning signs to look for, and the 3 key questions I ask before putting any antimicrobial on a wound. Stick around because I'll also tell you about the time silver made things worse, not better, and why that case changed how I practice. Let's start with the basics. Topical antimicrobials are meant to control bacteria on the surface of a wound. They include silver dressings and gels and ointments, iodine-based agents, PHMB, also known as polyhexamethyl biguanide, medical-grade honey, methylene blue, and antibiotic creams like bacitracin or neosporin. The goal is to stop bacteria from multiplying so the wound can heal. But here's the thing: they're not magic. They're tools, and like any tool, they have to match the job, or they can do more harm than good. These are the moments when topical antimicrobials are actually helpful. The wound is colonized, meaning there are too many bacteria slowing healing, even if it's not infected yet. There is a lot of drainage or odor. You suspect biofilm, especially if the wound is stuck in the inflammatory phase. The wound is high risk, like a diabetic foot ulcer or pressure injury in a frail patient. So let's say the wound isn't infected, but draining more, smells sweet or foul, and hasn't progressed in 2 weeks. That's when I reach for something like silver or iodine, short term, to give it a nudge. Now here's the flip side, what most people miss. Topical antimicrobials, especially silver and iodine, are cytotoxic. That means they don't just kill bacteria, they can also damage the healthy cells trying to close the wound. In particular, silver dressings can slow epithelial cell growth, which is exactly what we want during healing. There's literature that shows prolonged silver use can delay wound closure, even when the infection risk is low. And it gets worse. Some people develop hypersensitivity reactions, especially with silver sulfadiazine. I'm talking redness, itching, blistering. It can look like infection, but it's actually an allergic or inflammatory response. These reactions are rare, but not that rare, especially in patients with sulfa allergies or sensitive skin. Here's how I know it's time to stop. The wound looks raw, pale, or desiccated. Pain gets worse, not better. Edges are dry and rolled instead of filling in. There's no progress after 10 to 14 days. You see new slough, odor, or contact dermatitis. And here's a big one: you're using Santal and silver at the same time. Silver inactivates Santal, so you're basically throwing money and healing out the window. Let me tell you about Mr. D. He had a leg wound that was clean, but slow. Someone started silver gel, and the first week was great, but by week 3, the wound looked flat and pale and sluggish. So we paused and we switched to a hydrogel. 2 weeks later, granulation returned. Silver helped early, but it overstayed its welcome. Here's my checklist before starting or continuing topical antimicrobials. Is there a clear reason for concern? So is there drainage, odor, or slow progress? Am I planning to reassess in 10 to 14 days? Is this the right agent for this wound? And is it compatible with other treatments? If the answer to any of these is no, I hold off. We've been trained to act and to fix, but in wound care, sometimes not acting is a braver choice. Topicals are like spice. You need the right amount at the right time. Too little is useless. Too much is overwhelming. The goal isn't to kill every bug. The goal is to support the body in doing what it does best: heal. Remember when we said sometimes the problem isn't the wound, it's the plan? This is that moment. If you're using silver just to be safe or iodine every day for weeks, it's time to reevaluate. Healing isn't about aggression, it's about attention. Let the wound tell you what it needs. and when it's had enough. Thanks for watching. If this video helped, check out my next video on wet to dry dressings, because yes, people are still using them and we need to talk. Stay informed and heal well.